You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Hey, Health Innovators, welcome back to the show. On today, I'm sitting down with Kyle Swinsky, who is the co-founder and CEO of AMOpportunities. Welcome to the show, Kyle.
Thank you for having me. Thank you.
We were just talking a minute ago. I'm really excited about our conversation. I think it's going to be a little bit different than what we normally discuss. All things still innovation and being able to drive change and transformation in the industry, but from a slightly different perspective. So before we go ahead into our conversation, just share a little bit about your background so our audience can get a feel for who you are and what you've been innovating these days.
Yeah, of course. And again, thank you so much for this opportunity. My background, I've spent the last 15 years in higher education. I was a pre-medical student that started to get involved with international education and started seeing access problems where international students could not get into the United States, specifically in healthcare. So about 10 years ago, through those experiences, me and a colleague founded a company that helped international students get access to critically required clinical training. And we did so by setting up a lot of different sites around the country and building a technology platform that made it easier for the students. And also the fundamental mission was access. So making this something that at the time was very fragmented. There really was no solution. And really from that background, what's been really exciting is where the business has gone in the last 10 years, as that was the initial founding of the company. Through building the business, I got my MBA at the University of Chicago, and my colleague did his JD MBA at the same time. And we had a lot of different learnings that I love that this shows about innovation, because really through the 10 years, the business changed every single year. And I'm excited to see where this conversation goes, because the fundamental problem that we wanted to solve, which was access to education, is the exact same problem we're solving, but you have to innovate to get to where you are to make a bigger difference and solve that. So that's a little bit about my background.
Excellent. So I know you started the company in 2013. So happy birthday or happy anniversary. 10 years is a huge milestone. So congrats.
Thank you very much. Thank you very much.
Yeah. So let's talk about that a little bit in the sense of, the vision that you had, right? So you're saying that the mission kind of has been stayed tried and true through these 10 years. But the vision, I imagine, is probably somewhat evolved. And there's been a number of different trends, both headwinds and tailwinds, that might have influenced. What are some of those that kind of come to mind that's been some of the biggest influencers on how you've evolved the business over the last 10 years?
Well, I think the great part about sticking to the one mission, it's allowed us to have that foundation. But of course, through the 10 years, bringing international students into the country, there were a lot of immigration things that we saw through some of the years, as the pandemic was one of them.
Yep.
And then there were travel restrictions before that at sometimes. And then just really getting students into healthcare, getting sites prepared and getting them set up to train students is the hardest part, because that is the problem. There isn't enough access. There isn't enough connections between sites and students to get the students in. So I think there have been a lot of barriers, but what's been super exciting is the innovation on both sides. So we started as a marketplace where we first thought of bringing in doctors and said, doctors, would you teach international students? So connecting doctors to students. Started on spreadsheets, set up the operations, the business model, like all companies, and eventually found out technology would make that easier. So we built a Airbnb marketplace to give students a quicker choice, that they could apply for these programs and automate a lot in terms of the collection of their documents and the visa and things like that. But naturally, what we learned was going just individual preceptors, physicians, and individual students, there's a lot more you could do with network effects. And that's where we said, look, let's maybe instead of going after just doctors, let's now go after hospitals. Let's go after health systems and large associations. And the same thing we saw on the student side. We started going after universities. And what's really cool is it wasn't just going, I would say, vertical, it was also going horizontal, where we started just in medical sciences with international doctors, IMGs, which I'll get into in a moment, but they are such a backbone to United States primary care. We have a lot of training sites in rural care, but really from that backbone, it's really spread into osteopathic medicine, nurse
Yeah.
practitioners, physician assistants, pharmacy education. And that's the cool thing about innovation, as I'm sure you know, it keeps growing. And that fundamental problem that these students, their schools, they need clinical education. It hasn't gone away, unfortunately, but the way we solve it, you have to solve it differently every single time. So I would say through those barriers with immigration, with hospitals closing down with the pandemic, ICUs being taken for the needs, a lot of different barriers. We took our business virtual during the pandemic because we couldn't get students in, couldn't open sites, and through a lot of things like that, I'd say you're navigating through innovation.
Yeah, absolutely. It's interesting because there's a lot of research out there that says some of the most chaotic, stressful kind of failure, oh shit moments is when we breed a lot of creativity and innovation. And so I can imagine for you, if your business is pretty much built almost 100%, if not 100% on travel, people traveling from one country to another and having some kind of face-to-face clinical training, that you have to reinvent yourself really quickly in order to be able to have a sustainable model or in business, especially with everything that we faced in 2020, where we really weren't sure if this is a forever thing or if this is a 4-month thing.
No, exactly. And that's where I always go back to the fundamental problem, which why is access to clinical training important? Because it's half of healthcare education, and it's why a big reason why we have our shortages. So nursing schools are turning down students because they don't have enough clinical training. Really what clinical training is getting students into clinics, into hospitals, learning on the job what life is like in the different specialties. So whether it's learning internal medicine, whether it's surgery, and all of these different professions need that to graduate. So, I mean, it's really unfortunate that we don't have enough of that because obviously with more, we get more people on the front line. But still, I think it's just fascinating, going back to, seeing the things that we've gone through.
It almost seems, and I don't know if this is an accurate statement or not, but it almost seems like your innovation is taking place kind of at this intersection of healthcare education and almost like staffing shortages. It's, that I imagine tailwind is driving a lot of your, ability to be able to scale faster.
It's exactly that. So when we build our clinical network, our training sites, it's actually the workforce piece that drives them to teach. Obviously, in healthcare, there's a lot of altruism. So everyone wants to give back, especially to their community. Doctors want to teach the next generation. Nurses want to give back. But still, with the shortages, it's also about building strong pipelines. So what we do is we typically partner with the university. A lot of universities are now in the United States. And what we see is this university doesn't have OB-GYN rotations, or they don't have pediatrics rotations because they may have been shut down in the pandemic, or there's burnout and things are getting a little tougher. But typically these universities have us set up these training sites, partner them, and we make sure running these clinical rotations is very efficient. And I think it's a really good solution to help on the shortage, because when we, again, work with these sites, they're looking at this as a workforce development tool. They're looking at, if we work with this school, these students are going to continually come here. And a great statistic that we see is over a quarter, if not, I want to say 45% now of students actually are retained by the site that they train at, whether it's in residency programs or a year of core rotations. But statistically, you end up working where you're training because you create that deep bond with your peers and with your colleagues and the location.
Sure, that makes sense. So kind of talk us through, this evolution of your business model, how you started off B2C, what that decision was like transitioning to B2B, and then kind of managing both, that like multi-pronged business model that I think, a lot of companies really struggle with choosing one or the other, and then being able to balance the cost and focus of managing both at the same time. So how is that working for you guys?
I love that question because it's been an exciting journey. first, I go back to the same thing. The way we talk about the internally going B2C, growing B2B is that you're still getting the students the training they need. Going B2B is just finding a new way to bring in the same outcome. And that transition, I mean, it has taken years of development and growth.
Yeah.
But I think it's one that we've seen in a lot of other businesses, of course. You have a B2C marketplace, and the way to get scale is to go B2B, get a B2B marketplace.
Sure. Yep.
I think it's given us a lot of economies of scale where
Mhm.
individual schools can only do so much. Individual hospitals can only do so much. But when you have the network effect on both sides, where we have roughly 1,100 training sites around the country, and we work with over 100 and I want to say 120 universities now, you get so much more on both sides. And with the network effect, if you can bring more students, more potential workforce, you're going to get more training that wants to be on the platform, and vice versa. Of course, if you have more training, more schools, more students come. And I think growing from B2C to B2B has gone exactly that path, where you had to have enough of each side to get to the next step, but then also unifying your efforts internally. So I'm a big fan of business model innovation, where you can only go so far. For us, for example, everyone wanted us to jump into nursing probably 4 years ago when
Yeah.
we saw that enrollment numbers were spiking, clinicals were an issue, but you have to look at every process of the business, including the customer effect, including the outcomes, to really nail getting through that. And that's what we did to get to B2B, where we said, okay, if we're going to go from B2C, how does this affect our technology? How does this affect our marketing? How does this affect our sales? How does it affect the customer journey? And it took us about 2 years to get into nursing. And what we found out is that while we had our training sites teaching a certain way, we had to change the way they taught a little bit, which was
Mhm.
actually a difference of, rather than a 4-week type of block for medical students, nursing students would start on a certain date, but they could stay as long as they needed to finish their hours. So little bit by bit,
Mhm.
incremental change, I think, is the way you go from B2C to B2B. But I do know, like you're saying, I mean, it definitely has its challenges, that's for sure.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit.
You kind of mentioned a couple of terms that I want to just kind of level set with our audience, right? So a lot of things that you're describing is a platform business. And there's a lot of people out there that say that platform businesses are the ones that are going to be transforming the industry for all the reasons why businesses like Airbnb and Uber are transforming their respective industries. And then you talk about network effect. So what does it mean to be a platform business? And then what do you mean? You kind of touched on a little bit, but just give us a little bit more context of what do you mean when you say network effect, and how
Yeah.
would that maybe be different than more of some of the traditional business models?
So the network effect, or the social effect, I mean, it's the same thing as Facebook, right? Where the more people you have for every incremental student or person you add to the platform, it adds value to the platform that actually allows it to organically grow. So obviously, the first student for AMO in 2013, every student became easier and easier, word of mouth, them convincing their schools. So you get that network effect where for every student you add, for every school you add, you find business efficiency. And then you also get that on the matching in terms of a marketplace, where the marketplace, the platform, having students pair with sites, you can work on your vertical growth, but obviously on the horizontal side, you also get that effect where obviously the more clinical sites you're adding, every clinical site you add, there's much more value to the opposite side of the platform. So more students and schools join. And I mean, it really is chicken and the egg a lot of times as we build it, especially in new industries, but it's very intriguing to watch.
Yeah, yeah, absolutely. A science, I think, and an art of being able to balance supply and demand.
Yeah,
Yeah, right.
exactly.
You can't have a whole lot of students without sites to go to, and you can't have a whole lot of sites with no students to go to. So you're
Oh,
always trying to balance that, right?
no, exactly. And I think that's the benefit of technology. So we're, I say, tech-enabled services.
Yep.
It's our people that make everything happen. But what's great is the technology accelerates it and makes it more efficient. And what I mean by that is our sites with this network effect, they're not too happy if a month or two go by where they don't have students. So you may have too much on one side and then you start getting churn. You might lose the
Right.
side. Or if you convince a university that you have all of this on the other side and you don't, they only have a certain amount of time before they may leave the platform. And what the technology has been enabling us to do is to make sure that we're always getting that match. So scheduling, availability, the
Yep.
efficiencies, and that's why, I mean, I get very excited about the technology piece too, because if you look at clinical education as a whole, it's expensive to run. Getting a student to go to a different state to complete their hours, to have them get an evaluation completed, to make sure it's following all the accreditation in our education system, and then for them to come back to the school and report. There's just a lot of clunkiness. So the technology piece really does enable us as well.
One of the things that's interesting is that platform businesses usually have a higher valuation, which doesn't hurt, right?
Yeah, yeah, oh, exactly. Yeah, and I think that it's just I've seen that too, especially on software as a service SaaS businesses, and
Yep.
I think that it's just another extension of your B2C, you go B2B. If you can make your platform, I like to call us clinical training as a service, or a
Did you
platform.
make that up? I
We
saw that.
did.
I was going to ask you about that. And I'm like, okay, I've heard of medical device as a service. But what is this CTAAS?
So we took it off of a platform as a service and said,
Yeah.
we are a platform, but our platform is
Mm.
clinical training.
Yeah.
And what that's allowing us to do is we not only are able to make clinical education more efficient for our customers, but we also have universities and hospitals that want to use our software just as software, because they say, you know what, we could use your platform as a service, like a software as a service, but it still involves our people. So we still help them for certain services, such as our student services, our administrative services on the site, our recruiting services to get you new teachers or schools. So the CTAS is really more of an embellishment of a SaaS or a
Yeah.
PaaS platform.
Excellent. So, take us through your funding journey, right? There are tons of people in our audience that are at different places of their own capital raise. Some, just flying through it, and some, having some stumbling blocks, especially in this market with everything that's been happening. Was that journey like for you? And are there any lessons learned in that funding journey that you would want to share with our audience?
The story is so important. I have found, and we went through some pitch competitions. I mean, every single investor you work with is a pitch competition start. So you just have to really nail that story.
Yeah.
We were lucky enough for the first 4 or 5 years to be bootstrapped, and we didn't go the financing route. But when we were going through the economies of scale, and what we needed to go from B2C to B2B was actually reputation. And being a bootstrap, we founded the business right out of college. We wanted a reputation. So we said, let's look for some investors to give us that credibility. And in that first pitch competition, I remember how awful it actually was to start. And the reason it worked so well, and we won the competition, was
Oh my.
was coaching. I swear to God, it was coaching, because and all the coaching was, I mean, obviously there was so much information being shared, but it was perfecting your story. Because if you're doing what you're doing with your business, you for sure are solving something. It's how you communicate it. And I struggled with that as an early entrepreneur, and over time I found how important it was. And especially when you're innovating the business, you have to work on that every day, because you may give a talk, right? Like I'm gonna be talking to you about this right now, and a month from now you need to be talking about a little more something else. So you always are refining it. And I think on the venture capital route, we've raised, I want to say, about $10 or $11 million total so far. We've gone through multiple rounds of financing and have wonderful institutional investors. But the key the whole way has been that communication. So not just the story, but then going back to network effect, if you make sure your current investors know your story and are surrounding your story, it actually gets easier to raise every round because they start finding people, they know your story, you're communicating your story. But where I see the pitfalls come are, sometimes people go out for financing and they may not have that story together yet. And obviously, I'm sure as you coach so many companies, it's not just product market fit, problem solution. It's knowing your story, knowing how to definitively communicate that.
Absolutely. I can't tell you how many investors I speak to, and they said, listen, I've listened to 10 pitches today, and I still don't know what any of them do.
No, I've been in that room before myself on the defeat side. They're learning lessons, that's for sure.
Yeah, exactly. Okay, so then let's talk about your transition of being a face-to-face kind of boots on the ground company and then going to virtual and kind of what that model looks like now as you've evolved to probably more of a hybrid. Where are you going with it going forward?
So we have two different things. Are you thinking about virtual work or hybrid workforce or virtual education?
Virtual education.
Yeah.
So you have a technology platform that, I imagine is quite different than maybe the vision you had prior to the pandemic.
Oh, yeah. I mean, I remember how so important it was. I mean, I remember our first international students, they came from Sudan and Egypt, and it was just so special when they said, this is my first trip to the United States. They had a urology and a pediatrics rotation, and just the ability to acculturate, to see a different healthcare system in person, that was so important, sometimes more important than the actual techniques that they were learning.
Right.
But virtual, what we found was it was also very prohibitive to travel. Getting a visa, getting your travel set up. You have students in certain countries that will have to plan 2 years in advance. And sometimes, in healthcare, we don't have 2 years. So
Right.
virtual education, we launched it in 2020 when on the onset of the pandemic, and it actually really took off. And what really happened is because we couldn't get students to come into the country, and we also had students in this country that couldn't get into their clinicals, even just down the road, we followed the telehealth adoption where you saw pandemic started, telehealth just took off. Doctors started saying, you know what, if I don't see my patients virtually via telehealth, I'm going to lose my clinic. And what we found is with our existing network of clinicals, within about a week, we converted about 50 of our sites into hybrid sites where they could do both in-person training, and we created a curriculum so that they could be virtual training sites. And they get the same outcomes as students. You just see your patients virtually, you do your learning via Zoom, but there are limits, of course. So limits being there's certain things bedside manner that you need to learn still. Healthcare professionals probably need a majority still of in-person learning, but there are certain things you can do. Psychiatry, behavioral sciences, there's a lot, or dermatology that you can do virtually, and it doesn't negate from the learning outcomes. So I'd say right now, because of that, maybe 15-20% of our education any given month is conducted virtually. When the pandemic started, it was about 50-60%. And I would say that's probably where it's going to stay, I would say.
Really? Okay. Huh. That's a little lower than I would have expected, but I imagine part of it is just being immersed in that physical environment and building connections and, who doesn't want to do a study abroad?
Yeah. And then we found in the US markets, there's a lot of accreditation standards. So working with MD programs, DO programs, PA, MP, these accrediting bodies, they're the ones that say you need to have these in person. They didn't really budge that much during the pandemic because, I mean, how it is. You need to make sure you have your clinical hours to, get your license and see the millions of patients you see. So I understand why that's important.
Right. We want our doctors to be trained on site for the most part, right?
Only our doctors.
Yeah, exactly. Thank you so much for joining me today. As we kind of wrap up, is there anything else, just kind of as you look back on the last 10 years of your entrepreneurial journey and the milestones that you've achieved, is there anything else that you would want to share with our audience that might inspire or encourage or guide them in their own path?
Again, I just love that we are people focused because it's gotten us this far. I've seen companies that go product focused, companies that, there's different ways you can build a business. I think it works well, especially if you think of the industry you're in. Being in healthcare and education, your customers put their people first. So if you're not people focused and you're too focused on your product, you're not going to have the right balance. And I mean, just reflecting on the last 10 years, that's really been a foundation, and definitely would say that's really something to watch for.
And when you say that, do you mean people like customers, people like employees, or a combination of the two?
It's a combination.
Yeah.
So for example, our people internally, we know that they drive the technology. We know that our people are the ones that drive the vision. So I have a vision for the company. It's very derived from our company and our people and where they see their departments going. And that's really taken us far because they're the ones in the front line. They're the ones that see what's going on and they know best. Also on the customer, I've seen, mistakes where it's not a transaction. These are relationships, and that's very important in healthcare and education. The relationships that we started 10 years ago, or we started 5 years ago, you still have today. And if you would have focused on those like a transaction, you're going to kind of hit a dead end. So people focus definitely on both sides.
Excellent. Well, thank you so much for joining me today, Kyle, and sharing your experience with our audience.
No, thank you, Dr. Roxy. Thank you.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.